20 is the number. Michael Page, good morning and welcome.
Good morning, Nadia. Great to be with you and your listeners.
So how do you describe the state of our health system right now?
Look, I wouldn't describe it in very positive terms. I think certainly the public hospital system is in what I would describe as a rolling crisis. And we use the word crisis a lot, and I know it can start to lose its meaning. But, you know, any patient who's waited for 10 hours in an emergency department to see a doctor, any patient who's waiting, more than a year for an outpatient appointment or for elective surgery will understand that quite clearly there are pressures on our health system and an inadequacy of our health system's infrastructure and its capacity that are really not heading in the right direction. You know, we have this continually ageing population, we have a growing population, the needs of our healthcare system just keep growing, but it's not keeping pace with demand. So, any patient, any doctor who's worked in our public hospital system within the last year can attest to the fact that it's really just not up to scratch at the moment.
And so you say 10 hours waiting in an ED equates to a crisis. You're not catastrophising here, are you?
I don't think it's catastrophising it at all. Again, I think we just need to look at what our community's expectations ought to be of our hospital system. And I think anyone who has tried to access care through our emergency departments, and this is not at all a criticism of the doctors and nurses working in our EDs who are doing a fantastic job, but they do it under very arduous conditions, which is inadequate capacity. And we all know that the issue we've got, we see the headlines every week or every month on ambulance ramping figures. And as we know, ambulance ramping is just a symptom of not having enough beds across the hospital system. Ambulances are stuck outside the hospitals waiting to offload their patients into the emergency department. The emergency departments are half full of patients waiting for a bed on the ward. And that's because we just don't have those beds. And of course, beds, we're talking about more than just physical beds. We're talking about physical beds plus the staff.
Because it's all very well to have extra beds, but if you don't have the staff, then those beds can't open.
Indeed. And so what we've seen is a failure of long-term planning by successive governments. And this is not a criticism aimed at our current government necessarily. This is successive governments that have failed to plan both health infrastructure and training of local health workforce. And the longer we wait to do something definitive about it, for the state government to come up with a visionary plan to fix the problems that we have in our health system, the longer and harder the road back is going to be. And I suppose we're just becoming increasingly concerned that we're never going to get there, and that the healthcare system the people of WA can expect in the future, certainly on the public side, is never going to be what it used to be in the past.